In this video, we will focus on the drugs or medication that help in weight loss. In particular, we will focus on which patient benefits, whether or not it's effective, what surveillance is required once you start the medication. We will discuss individual medication that are available, and then medication that is not approved, and finally draw some conclusions. It is important before embarking on medication to lose weight that this is only part of a multimodality treatment that includes a change in diet, increase in exercise, and a modification in behavior. It is also important to understand the risks and benefits. Let us now define the goals of taking medication. And the first one is to achieve and maintain weight loss. Research evidence has shown that a 5 to 7% weight loss health benefits and reducing the risks. In doing so, it is hugely important to encourage healthy lifestyle and hence reduce the risk of cardiovascular, metabolic, psychological, and other health issues related with being overweight. And finally, when taking medication, to minimize the adverse effects. Now, which patients would be suitable for taking medication? This assessment is based on obesity and general health and comorbidity, because there are certain medications that may not be suitable for some patients, but more likely to be beneficial in others. In general, anyone with a BMI of greater than 30, that's body mass index, that is derived by dividing weight in kilograms divided by height in meters squared, or BMI of greater than 27 but with a comorbidity related to obesity such as cardiovascular, dyslipidemia, sleep apnea, type 2 diabetes, etc. Finally, every attempt should be made by changing the lifestyle with diet and exercise changes, and if these have not been successful over a 3 to 6 month period, then such medication may be considered. The following are the FDA approved drugs in the US for weight loss, and predominantly it is this group which is most prescribed. The GLP-1, glucagon-like peptide agonists. These drugs reduce appetite and help in weight loss, etc. Orlistat, that affects fat absorption. And then there are older combinations which are less commonly used. And finally, there are others which are for short-term use only, in general up to 12 weeks. There is another exciting drug that is available for treatment of type 2 diabetes and related to the GLP-1 agonists that I will talk about a bit later. Now, once medication is started, then what kind of monitoring is required? In general, 6 weekly checks are carried out to determine weight loss, and a minimum should be 4 to 5% at 12 weeks at the maximum dose. Assessment of the blood pressure and heart rate, and for diabetics, assessment of their diabetic control. It is also important to be aware of specific side effects related with each treatment. Before embarking on any treatment, the patient has to be warned that any medication may have a variable effect. It may be very effective for some, moderate for others, and not at all for a smaller minority. For most patients, once the treatment is started, there may be an increase in weight loss and afterwards a plateau phase, so that further treatment is not effective. And finally, the choice of the medication is dependent on the patient, their comorbidity, and what other diseases they may have. This slide has a list of medications that initially were developed for another purpose but were found to help in weight loss. The ones not mentioned here are those primarily developed for treating type 2 diabetes, such as semaglutide or Ozempic. The others are anti-seizure medication, antidepressants, antipsychotics, those for attention deficit hyperactivity disorder. This is an important slide denoting the amount of weight loss. So coming down over here in percentage means more weight loss versus individual medication over here. So you can see that semaglutide or Ozempic may lead to a weight loss of up to 15% over a 3-month period compared to placebo or controls. A similar medication, liraglutide, up to 6%, orlistat, the same, and then the combination of phentermine and topiramate, up to 10%, less so for the other combination. Which is the most suitable patient? Who should not take it? How is it taken? What is the efficacy, side effects, and cost if relevant? The go-to medication currently is semaglutide by the trade name Ozempic, Wegovy, or Rybelsus. It is a GLP-1 agonist. It reduces appetite and encourages weight loss. It was initially developed for type 2 diabetics. All other patients attempting weight loss may be candidates. Those with known thyroid cancers, previous pancreatitis, or kidney stones may not be suitable. Initially, it was a subcutaneous injection taken once a day or a weekly injection. More recently, tablets have become available. The common side effects are nausea, vomiting, diarrhea, constipation, low blood sugar at times, but rare complications occur with development of medullary thyroid cancer, pancreatitis, gallbladder issues, or problems with blurred vision. It is quite costly if you just take list cost, but for those in the US, the insurance may cover the exciting new medication, which is even more effective than semaglutide or Ozempic, is tirzepatide. The trade name is Mounjaro. This is currently approved for type 2 diabetes, and FDA approval for weight loss is in the pipeline. It is a novel medication which is GLP-1 and GIP agonist, generally safe, and research evidence has suggested sustained and effective weight loss. So watch this space, because this is a new star on the horizon. Orlistat is more commonly available with the trade name Xanicol. For patients who are intolerant of semaglutide, Ozempic, etc., may be candidates for Orlistat. And the main effect is by neutralizing lipase that digests fat in the bowel. The patients are unable to absorb fat in their meals. Those who have malabsorption, calcium oxalate stones, or pregnant women should not take this medication. It is available as oral tablets. And the side effects of cramps, flatus, loud noise, fatty spotting in the stool may lead to up to 30% of the patients giving up on the treatment. Fat-soluble vitamins such as vitamin A, D, and K patients may require supplements. There are rare instances, liver or kidney failure. The cost of it may sometimes be a feature. The weight loss expected is moderate, up to 6%. However, generally it is very safe and well tolerated. The combination phentermine and topiramate is available as an oral capsule. These are the older medication which were approved previously by FDA. In patients who are intolerant of GLP-1, that is Ozempic, semaglutide, etc., may be candidates, specifically males or postmenopausal women. Patients with uncontrolled blood pressure or pregnancy must not take this medication. And the side effects include neuropsychiatric, anxiety, depression, rarely suicidal thoughts. There are other dose-related. The combination older medication are no longer. A word about the sympathomimetic medication. These stimulate the sympathetic nervous system, thus increasing heart rate, metabolic activity, and sometimes blood pressure. These medication includes phentermine, diethylpyrione, and phentermine. As mentioned before, these drugs are no longer first line. However, I mention them because increasingly diet supplements, especially from overseas, may contain traces, parts of these medication, which may have serious consequences for some patients. So here are the following drugs that should not be taken for weight loss. The FDA asked the manufacturers or lorcaserin to withdraw this medication because of increased risk of cancer. There are increasing reports, health supplements, especially from South America and Brazil, including traces of or higher doses of medication which are not safe to take and may have a sympathomimetic action, causing anxiety, higher heart rates, blood pressure, etc. Ephedrine is a similar medication. In terms of efficacy, the following have not been found to be effective in weight loss, such as green tea, guar, or chromium-related products, human chorionic gonadotrophin, as well as products based on calcium. Finally, weight loss ought to be part of a multimodality treatment, specifically with diet and exercise, and giving patients at least a 3 to 6 month period before considering drug treatment. Patients ought to be selected carefully and assessed by physicians so that the correct treatment may be started. Follow-up and surveillance is essential to reduce risk to the patients of side effects and improving efficacy of prescribed treatments. This completes this topic. If you have any comments, please do share.